It's now my pleasure to introduce to you the Dean of Medicine and Head of School, Professor Ian Simons.
Thank you very much, Nicole, and welcome everybody to this wonderful facility on this rather cool and grey Adelaide Sunday morning. As Nicole said, my name's Ian Simons. I'm the Dean of Medicine here, and it's my very great pleasure this morning to talk to you about the medical program here and to say a few words about the Faculty of Health and Medical Sciences and the School of Medicine. So, as Nicole has said, what we're going to do this morning is I'm going to talk for about 20-25 minutes, telling you a little bit about the faculty, the course here. Then Nicole is going to say a few words about the admissions process to medicine, and then we have our panellists, Jess and Ashley, who are going to say a few words about their experience as current students in the medical program, and then we'll have an opportunity for question and answers with myself and our student panel. And be finishing in about an hour or so. So first of all, welcome everybody, and to our online audience on Facebook Live. I'd first of all like to acknowledge the Kaurna people, the traditional custodians on the lands on which the university campuses of North Terrace, Waite and Roseworthy are built, and pay my respects to their elders past and present. So, the Faculty of Health and Medical Sciences is one of the key faculties of the University of Adelaide. And I'm delighted to say that in the most recent Good Universities Guide, it ranked #1 in South Australia for overall student experience in health and medical sciences, and #1 in South Australia for teaching quality. And in fact, we take pride in preparing our students to be leaders of tomorrow's health professional delivery and research, with a proud heritage of awards for our students, including 24 Rhodes Scholarships, where students travel overseas to Oxford to study, and 14 Fulbright Scholarships for study in the United States. Students at the faculty have an opportunity to learn from and alongside some of the leading researchers in health research in the world. We have award-winning teachers and academics here who are respected internationally for their work, have attracted millions of dollars in competitive research funding, and we are the proud, we number amongst our alumni 2 Nobel Prize winners, including Lord Howard Florey, who developed penicillin, which is estimated to have saved more than 80 million lives in the last century. Before I talk a little bit about the program, I just want to say a few words about the building that you're sitting in at the moment. So this Adelaide Health and Medical Sciences building represents the largest investment the University of Adelaide has ever made in teaching and research infrastructure. It officially opened in February of last year, and in its 14 stories includes the Adelaide Dental Hospital, and is home to the Adelaide Medical School, the Nursing School, the School of Psychology, as well as the School of Public Health. We have more than 600 research and teaching staff based in this building, and host courses across those different school areas for almost 1,600 students. We've just got a short video grab for you about the program.
When life is in my hands, I will be prepared.
When I am needed, trust me to provide care and support to people and their families.
I will improve health and well-being by delivering cutting-edge oral health care.
To develop the knowledge and skills I need to succeed.
I chose to study at the University of Adelaide.
The new Adelaide Health and Medical Sciences building will take my studies into the future and transform the way I learn.
As part of the Adelaide Biomed City, I am a part of something big.
I'll study alongside future colleagues, learn from leading academics, and build relationships with industry partners.
I'll be connected to innovative research, provide real patient care,
and will gain hands-on experience using the most advanced simulation equipment in Australasia.
Working alongside dental professionals, I will deliver oral health services to South Australians.
Together, we are the future of healthcare. We will be prepared, and we will lead the way.
Okay, so as that grab says, you are considering studying health, medical sciences, medicine here at one of the most exciting times in the history of medical studies in South Australia, certainly at the University of Adelaide. We have the most outstanding facilities in terms of teaching and learning, both within this building and access to the state-of-the-art clinical training facilities, not only at the Royal Adelaide Hospital, but across the rest of South Australia. I'm going to say a little bit more in a minute about the detail of each phase of the medical program, but just to give a quick overview. So the medical program in South Australia is the third oldest in Australia. Began in 1885 with just 6 male entrants. So it actually predates Australia as a country as a medical program. It was the first medical program to admit and graduate female graduates as well in Australia, with the first female surgeon in Australia being one of our alumni. From the start of the degree, over the 6 years, students are introduced to learning in the context of real-life clinical scenarios. We don't start by abstract learning about biochemistry, anatomy, physiology and so forth, but we integrate that into solving the sort of clinical problems that you're going to be faced with as a doctor. And alongside working on the knowledge of how to diagnose and treat medical conditions and understanding the basic function and structure of the body, both in illness and in health, we also begin at the very start of the program to teach about how to work in teams, about what it means to be a medical professional, about the skills needed to communicate with people, about how healthcare systems work, and about the public health challenges that will face our graduates in the rest of their professional lifetime. As you progress through and acquire different skills, you work towards the final year of the program, which is really focused around preparing graduates for the next step, that crucial step when they put the name doctor on their lapel and are actually taking responsibility for patient healthcare. And I'm delighted to say that in last year's AMC independent survey of medical programs throughout Australia, Adelaide ranked number 1 in terms of preparing students for internship and number 1 for the amount of clinical experience that students had access to during the course of their undergraduate training. Okay, so life at university, and particularly studying medicine, is very different from secondary school. You're here, or hopefully you will be here, to learn because you want to. Getting into medicine is competitive, and so we know that all of the students who are in our faculty at the moment are there because they're motivated to become doctors or other healthcare professionals. Being a doctor is not about working alone anymore, if it ever was. It's about working as part of a team. And so we believe that you should learn as well as part of a team. And the fundamental premise upon which our program of study is based is small group learning and then small group work as part of clinical teams on clinical placement. Remember that this is not a competitive race about who gets to be top of the class. This is about reaching the necessary standard to be an outstanding practitioner for the rest of your life. And in that sense, it's just the first step on a much longer pathway of continuous learning and continuous professional development. The key to all this is clearly people. People in the patients that you will interact with as you learn, people with the scientists and the teachers that you will learn from and with during the course of the program. But at the same time, it doesn't do any harm to have access to outstanding facilities to learn in. And one aspect of the medical program that we are particularly proud of at the moment is the facilities for clinical simulation. You would not expect to get into an aeroplane with a pilot who had never done any time on a simulator before they were allowed to be behind the wheel or the joystick of the aeroplane. And we do not expect that our graduates of the future will practice on patients until they have honed their skills that they can develop in the most realistic clinical simulation facilities available. So 2 floors above us, we have the largest clinical simulation facility in Australasia, with 24 rooms that are designed to be mock-ups of the hospitals that you'll be working in, 4 critical care suites which can be modified to be operating theatres, emergency departments, intensive care units, delivery suites, 8 acute care ward settings and 4 virtual home environments to cover the whole spectrum of healthcare scenarios from the community all the way through to intensive care. But simulation is more than about practicing on lifelike mannequins, clinical skills necessary to resuscitate patients or operate on them. It's also about the opportunity to learn in a safe environment where you can make mistakes and learn from them without harming anybody or anything, and an opportunity to work as part of a team to develop those crucial team care skills that are an integral part of modern medical practice. Okay, so I guess from what I've said already, you can gather that becoming a doctor involves much more than just memorising information. When I went to medical school, not that long ago, our dean told us at the start of our course that half of what we would learn at medical school would be out of date within 10 years of us graduating. That figure is now 4 months. So you can take it that simply memorising from rote all the factual information about medicine, contemporary treatment and so forth is not ever going to be possible during the course of even 6 years at medical school. What we want you to know, to be able to do, is to know where to access the most recent and up-to-date information that you need for clinical practice, how to interpret that, appraise it, decide what is good and valid information and what isn't, and then to be able to apply that knowledge and understanding to manage not only individual patient healthcare, but also problems that affect your local community and indeed the global community. We want you to be able to be masters of communication skills and foster and nurture that empathy that we know that you will bring into medicine throughout the course of the program to make you outstanding doctors. And we want, by the end of the program, that you have the skills necessary to acquire the medical knowledge that you will need for the rest of your professional career through self-directed learning and research, whether you become a GP, a specialist, or indeed work in an area outside of medicine after graduation. Medicine is also somewhat different from other university degrees in that your courses almost entirely are specific for medical studies and becoming a doctor, rather than a selection of independent courses and electives from various different components of the university. And I think it would be true to say that when you compare what you are doing in your first semester and then onwards, the workload and the intensity and what's expected of you as medical students is certainly different from other non-professional degrees. So doing medicine involves a commitment to study of around about 40 to 45 hours a week of work. Not all of that is coming to lectures or attending classes or being on clinical placement. In the first 3 years of the program, we usually expect students to spend roughly half of that time on self-directed study. When you move into the clinical part of the program, then you move into more full-time clinical placements in preparation for indeed when you will be working full-time as an intern at the end of that process. So the program is 6 years in length, the first 3 years of which are predominantly based at this precinct, with some learning in areas such as anatomy taking place on Frome Road, where the rest of the faculty's facilities are located. You do get to have an early opportunity for seeing patients and interacting with them, initially within the building here with simulated and real patients who come and help us out with teaching, but in the third year of the program with clinical placements at the Royal Adelaide and the Queen Elizabeth hospitals, where you spend a day a week going to the hospitals to see patients during that time. The bulk of the first 3 years of the program is based around something called case-based learning. For those of you who may have heard of problem-based learning, it's basically a variant on that. Each week you're presented with a new clinical scenario. That may not necessarily just be an individual patient with a particular problem. It could be a public health scenario like an outbreak of food poisoning or something like that. And as a group of 8 to 10 students, you will then work through the various aspects that underpin understanding the underlying processes that have led to that presentation and learning something about the management and diagnosis of those conditions. So we use those cases to trigger learning about the anatomy of the body, the physiology, the biochemistry, the psychology, the public health aspects, the professionalism aspects that all go into the integrated skills that are necessary ultimately to become a doctor. As I said, alongside that, there is a program of practical classes that are based around clinical simulation, learning how to take histories, examine patients, perform things like basic life support, do basic procedures like taking blood and doing intravenous cannulation. We provide additional resources, both online and face-to-face, in the form of seminars and lectures from experts in the field, including our large community of title holders who help us and contribute to teaching throughout the 6 years of the program. And we have practical sessions in the anatomy class where you get to dissect bodies and understand the way in which the human body works, and microbiology, and as I've said, those all-important teamwork and professional skills. In year 4 of the program, you begin to move into full-time clinical placement. And over the course of years 4 and 5, you rotate through a number of hospital and GP-based placements in a whole range of areas, from medicine through to paediatrics, obstetrics and gynecology, psychiatry, community-based placements. We have a wide range of elective choices during those years for our students. This is the time at which you hone your skills in history taking and diagnosis and begin to learn the critical aspects of treatment and management for the common conditions that affect those various areas of practice. Approximately 25% of our students spend the entire 5th year at our rural clinical schools in the north and west of the state, ranging from areas in the Barossa Valley all the way out to Ceduna. And those students undertake a slightly different model of learning, where they're attached to usually a general practitioner in the town in which they're working. They become an embedded part of the community, and they learn about the various aspects of the program that we cover during that year, such as paediatrics and women's health care, but in the context of learning alongside their GP mentor and at the local small hospital in those areas. There are also other opportunities for learning in rural and remote settings in the 4th and the 6th year of the program. Finally, in year 6, as I mentioned at the beginning, we are particularly proud of our transition to internship program, where students are attached as pre-interns to the medical, surgical, and mental health areas that they will be working in subsequently as interns. The focus here really is around the nuts and bolts of what you actually need to be able to do to function as an intern, and in many cases during this year, students under supervision will assist with many of the direct patient care duties as part of those teams. So here the focus is around things like prescribing, patient safety, how healthcare systems work. The other half of that year consists of a series of selective, these are elective options, and about 70% of our students undertake at least one of those placements overseas as part of the Dean's elective. So we strongly encourage our students to get an alternative perspective on how healthcare works by travelling overseas and either experiencing it in other developed or in many cases in developing countries as part of that program. This year we have also begun for the first time an exchange program with the University of Aarhus in Denmark, which allows students in the 5th year of the program to take a whole 6 months of their program in Europe, and we in turn take students from Denmark here to study for 6 months, and then we give the appropriate credit for students when they return as part of that. Okay. Medical careers, as I've said, start with medical school, but really that is just the first step in training. Nobody leaves medical school, goes and sets up their plate on an office somewhere and starts practicing as a doctor. Following graduation, you have at least 2 more years of general training as an intern and then as a resident. And then after that, most graduates will spend at least another 1 or 2 years working as a resident or an unaccredited registrar before they enter specialist general practice or vocational training. And of course, the whole spectrum of medical practice is open to you. We graduate generic graduates who can go into any field of clinical practice, academic research or teaching that they want to subsequently. And one of the great things about a career in medicine is the enormous range of different things that you can undertake, both within general practice and indeed as a specialist or a subspecialist. But a medical degree is a pathway not only to clinical practice. We have graduates who work for World Health Organization, government departments. Many of the researchers in this building are medical graduates, as indeed are the leaders in the curriculum development and leadership. Medical practice, medico-legal practice, health service administration, business, politics, the arts. Medical graduates, you'll find them everywhere. But I think it is testament to the passion of our graduates about what they came here to do, and to the wide range of opportunities within the field of clinical practice, that around about 95% of our graduates will still be in clinical practice of some form or other for the rest of their lives. Okay, so I'm going to hand over to Nicole now, who's going to talk to you a little bit about the admissions process.
Great, thank you, Professor Simons. Okay, so I just wanted to highlight to you today the entry requirements, and this is for domestic applicants, okay? So for those of you who are in Year 12 now and considering applying for this program, please make sure that you have already registered for the UMAT, or if not, that you do it very promptly because it's closing shortly. So first of all, UMAT registration, then you sit the UMAT. You have an application through SATAC, so the South Australian Tertiary Admission Centre, and most of your high schools will help you with that, but please don't just rely on that. Make sure you're proactive and can do that for yourself. Then we have an interview process. There's prerequisite subjects, and then there's the academic result. So the prerequisite subjects, you either need to be studying chemistry or biology or maths methods. Okay, so one of the 3, you don't have to do all 3. If you are, great, but you must be doing at least one. Now, based on how you go in the UMAT actually determines whether we invite you for an interview. So essentially we rank everyone that has the University of Adelaide as a preference, that has sat the UMAT, we rank you from highest to lowest, and we invite the top 800 UMAT performers to an interview. The interviews are held in late November, early December in this particular building here. And when you are invited for an interview, you will actually be able to log on to our admission system and choose a date and time. Please don't dilly-dally in that, because once the times, you may not get the selection that you want. So please, if you're invited, please do that straight away. The academic result that you need is an ATAR of 90, so 90 or above, okay? Once we have all of the parts of that process, we rank the UMAT is worth 20%, and I might just mention that, I'll talk about the UMAT in a moment, but there is 3 sections to the UMAT, and we weight each of those sections evenly. So UMAT is worth 20%, the interview is worth 40%, and the academic result is also worth 40%. Now, we have a total of 134 domestic places in our medicine program, and that is made up of 34 places for rural pathway, 5 places for the Aboriginal and Torres Strait Islander pathway, and 20 for the higher education pathway. So the audience members who were here in the previous session who are considering maybe doing health and medical sciences first and then applying to med, that is the amount of places that we would have for those particular pathways. Okay, so the dreaded UMAT. As I mentioned, I hope you've all registered for it, but the UMAT is designed to assess the general abilities and attributes gained through prior experience and learning, specifically the acquisition of skills in critical thinking, problem solving, understanding people, and abstract non-verbal reasoning. And these abilities are considered important to the study and later practice of professions in health sciences. It's a 3-hour test, it's online. I won't go into too much more detail because the ASA website or the UMAT website actually has all of the detail that you will need. Now, the University of Adelaide doesn't endorse any UMAT preparation courses. That's entirely a personal choice if you choose to prepare that way. But once you register for the UMAT, you will get access to practice materials from the website, from the people that are actually making the tests themselves, and that's how we would suggest that you prepare. When you come to do your SATAC application, there are 2 codes that you can use. One of them is related to a non-bonded medical place, which is 314522, and bonded medical place 314533. When you do your SATAC application, you have 6 preferences that you can list for universities across South Australia and the Northern Territory. So if you were to choose to select both of these, that would take up 2 of your 6 preferences. So a non-bonded medical place, these places have no return of service obligations after graduation. You come with us for 6 years, you'll graduate and you'll go off and work in an area that you can gain work in. The bonded medical places, so students accepting these places, undertake work in a workforce shortage area after completing their professional training. So this is for a period of 12 months and it can be worked in blocks of no less than 12 weeks. And this period can be completed between commencing your internship and 5 years after fellowship. So you will only be selected to go when and if there is a workforce shortage. I would really encourage you to access the Department of Health and Ageing's website. This is where it has all the detailed information about a bonded medical place. It's important that you know what you're applying for so that you are comfortable with the requirements, because it is a bond or an agreement between you and the government to repay your service. So please access that when you can. Okay. So we do have a very comprehensive admissions guide which is available online, so please via our Faculty of Health and Medical Sciences website, click study with us and then you'll find, click medicine and then you'll see the actual admissions guide. This has all of the information that you will need to know about not only the process, a little bit about the program itself, but also the requirements of things like the interview, etc. So please make sure you're looking at that. So the entry requirements I've just outlined are for domestic applicants. So if you're an Aboriginal or Torres Strait Islander applicant, a higher education pathway applicant or an international applicant, their entry requirements will differ slightly, so please access this medicine admissions guide to see the specifics for that pathway that you're applying under. Okay, so now Professor Simons is going to lead the student panel, so if I could please ask Jess and Ashley to the red chairs. They're all very colour coordinated today.
So Jess is in her 4th year of the current medical program and Ashley in year 2. I'm just going to ask them to say a few words about their experience of starting medicine here, what they've done so far, what they found to be the challenges and rewards of studying medicine here, and then we'll have some Q&A.
Okay, thank you. So, as I said, I was introduced, I'm Jessica, I'm in my 4th year. I have absolutely loved my my medical career so far. The first 3 years, I did have a lot of challenges, but I had the amazing support from the university, which I think is something that Adelaide Uni should be proud of is their support for students. In terms of the program, my favourite things, I guess I could say, would be the clinical exposure that we get from day one in terms of our clinical skills, where we have the actors or the patients who come in and help us learn how to take a history, do a physical examination. Those skills are paramount for when we come into our clinical years, which I've just entered. And also you get to feel like a doctor from day one. It's not learning about biology and that you're like, this is what I'm going to be doing for the rest of my life. So that's probably one of the things that I've absolutely loved about the Adelaide Medical Program. It is a lot of work. As we said, the 45 hours, some weeks I'd probably do more than that, other weeks maybe not. Leading up to exams, I'd do much more than that. So it is something that you've got to consider, you know, are you prepared to put in those hours and that time? The other thing that, as Prof Simons had said, is this is a career of lifelong learning. So I think, you know, you've got to love to learn, and that's probably one of the main reasons I went into medicine, other than I want to, you know, help and care for patients and family when they're ill. So I'll pass on to Ashley to give her perspective.
Yeah, I'm Ashley and I'm in my second year of medicine this year. So I moved from Central Victoria to Adelaide to study over here, and I've loved every second of my medical degree so far. I'm the same as Jess. I've loved our clinical encounters, so I'm still in pre-clin, so I haven't made it to the hospitals yet, but every week we have a couple of hours doing clinical practice where we have standardised patients that come in and we can take a history or do a physical examination with them, and it's really cool to start, as Jess said, learning to be a doctor from day one. It gives you a real perspective of what life's going to be when we finish our degree. So.
Great. Okay, thank you. Any questions? Yeah. So the question was, do you have part-time jobs while you're studying? Is that possible?
I work 5 hours a week for a place back home, so I just do online work, so it's quite flexible for me. I don't have many friends, I don't have many friends that do part-time work, but I do also have some people that are able to do it, so it's completely up to you whether you can fit it in.
Yeah, absolutely. Even in the clinical years, when I guess we are working full-time hours, I have a lot of peers who do like tutoring and that sort of thing. So I think there's definitely the opportunity to have a part-time job. You've just got to choose it wisely. And I would say I would minimise the hours. I don't think you would be doing, you know, multiple shifts a week. Most of my peers do maybe one afternoon shift and a weekend shift. Saying that you must be organised to be able to fit that in. And also, one thing that I would suggest is try and get that life study balance, which is, I think, one of the toughest things about med school is trying to work out how you get your hobbies, living, and you're doing your study as well. But it is definitely possible throughout the whole degree.
Any other questions? Yep. Oh, so the prerequisite subjects, are you sort of meaning which one would be best to choose? Is that what you're thinking? Yeah. So chemistry and biology and maths would all be part of, you know, the medicine program in some form. If you're thinking about what to select in Year 12, then our advice would be to select one of those that you're good at, because then you're most likely to enjoy it and do better at it. So I think sometimes the students have said that biology is potentially something that would, if you had to choose one, that would be the most beneficial. Is that right, girls?
Absolutely, yeah. So I did the whole three, but I used my biology knowledge the most. Maths, not so much. And chemistry, a little bit in the preclinical years, but after you get past that, not very much at all.
Yeah, did you have a supplementary? Yeah. So the question was, is the biochemistry, as opposed to other types of chemistry, I guess, behind what you need in medicine?
Again, I would go back to probably, yes, it is important. Everything within medicine, those basic sciences are important. I personally would, if you had to choose between bio and chemistry, again, do biology. Saying that, the amount of knowledge you need in medicine, like I didn't do physics and there's a little bit of physics, and I picked that up quite easily. So I don't think you're at a disadvantage if you don't do chemistry, for example.
And we don't assume any prior knowledge of biology, because obviously it's not a prerequisite if you've done maths as an alternative. We have a course called Foundations of Biological Sciences that runs during the first semester. And obviously students who've done biology and so forth before find that a little easier to do. But I think by the time you get to the end of the first 2 years of the program, whatever you did at school, really, it doesn't matter terribly much. And certainly not by the time you finish medical school. So really, the strategy has to be to go with the thing that will give you the best score in your ATAR for those purposes.
Yep.
Yeah. So within all medical programs, there are elective options where you can choose an area that you want to study in more detail. The question was, can you specialise within an area of medicine? You can't until you reach at least 2 years after graduation, because the first year is a series of rotations where you have to do a minimum amount in emergency, in mental health, in medicine, in surgery, etc. Beyond that, you can begin to pick out a potential career pathway towards the end of that year and subsequently, but most people really don't start specialist training until they're a couple of years out of medical school. And of course, around about 40% of our workforce goes into general practice, who cover a whole spectrum of human conditions as well. So yeah, it is certainly true that most medical practice, people do choose to specialise in a particular area or general practice.
I would just add on that one. In my personal experience, I thought, so going into med, I'm like paediatrics all the way. And I've just started my clinical placement like 18 weeks in, and I've experienced some of the most amazing things, like with ENT, for example. I was in theatre, and I found the sinuses really interesting, which I think I never thought I would. So that specialisation, I would be open in the medical program, be open to these opportunities, because I've been surprised by what other careers are out there and that I might be interested in. So I don't think yes, think about it, of course, but be open to a lot of other opportunities as well.
Yeah. Do you remember? The question was, what was your experience with the interviews and the UMAT process?
So it was a little while ago now, but you sit the UMAT in June, and then you just do the best you can with the UMAT. Then you'll hopefully get an interview. The interview at Adelaide is, I think it's still the 2 separate rooms where you just go in there. There's a few people, they'll ask you a few questions, and you just chat and be yourself, and you'll get through it. So
essentially, it's the interview is not only seeing how you are as a student, but seeing if you are right for the course and if the course is right for you. So as Professor Simons was saying, it's a very hands-on course, and some people don't like that. So I think it's important to have a look at the way courses are taught and see whether that resonates with you and see whether you like to learn in that method. So as Ashley mentioned, it's 2 15-minute interviews. So you'll have a 15-minute interview with 2 people, 5-minute break where you'll be given a problem, a scenario, and you'll have some time to prepare some answers to that problem, and then the next 15 minutes with 2 other interviewers, and you will essentially present what you have solved in that time.
What is expected of you of the interview? First thing I would encourage you to do is to look at our admissions guide, which gives a little bit more detail in the sort of attributes that we're trying to test in the interview. I guess what we're looking for is people to be themselves, to answer honestly, to look at, you know, what they can draw on from their life experiences in terms of informing those answers where relevant as part of that. It helps us to assess what your verbal communication skills are and to probe a little bit more into your motivations for wanting to be a doctor. So, you know, again, there are lots of people who offer sort of practice tutoring and that sort of thing. We don't endorse any particular approach to that, but I'm looking for genuineness rather than rehearsed responses.
I can add on to that. I literally walked into my interview and was into the more personal, you know, why do you want to study medicine, that sort of side, and was like, yep, suffered depression for 3 years. I've had this experience, that experience. I think with the interview, don't overthink it. Be yourself. That's what Adelaide want. They want the genuine people that are going to make it through the degree and want to study medicine for the right reasons. So be yourself. I think, you know, they could have said, oh, it's this depressed girl, she's not going to get through it, but they didn't. Here I am, 4th year. So yeah, be yourself. Best advice I've been given.
Any other questions? Yeah.
Obviously, like in the medical field, there's a lot to deal with, especially if you're working in situations where there's like possibility for loss and like. So does the course kind of cover how to deal with that sort of stuff? Because obviously it's like a new environment where you're kind of someone's life or their bonus is in your hands.
Yeah. So the question was, does the course cover how to deal with difficult situations like death and dying and stress and so forth? Yeah, well, obviously, I might get Jessica and Ashley to sort of put their comments on that perspective because, you know, don't believe me, ask them. But from my point of view, as the head of the school, firstly, medicine as a career is inevitably going to expose you to those kind of experiences. And you can't get away from the fact that on clinical placements, those sort of things can and will occur, and we recognise that happens. We try and make sure that where students are exposed to those sort of situations, they have an opportunity to debrief with the person who's supervising them. We've all been through it. We know how stressful it can be the first time it happens to you. And we do our best to protect our students in those circumstances from that. And more importantly, teach them the skills of being able to how to come to terms with those things in the future. So part of what we have in our program, for example, in a simulated environment, is simulating things like breaking bad news or dealing with difficult situations. We can do that in a non-threatening situation, have a chance to get constructive feedback about how to do that. And there are ways of approaching those situations to maintain that sort of both empathy but also that necessary degree of professional detachment.
Absolutely agree. The program does touch on these things, but I personally haven't been exposed thus far, but I have had a friend who did a a palliative care placement, and yeah, she did lose a patient on her first day. The one thing I would like to say about the medical cohort in particular, which is probably quite different to your other universities' degrees, is that we are very, very close. So, you know, she rang up myself and we had a really good chat and we caught up for a coffee. But so that's on a personal student level. But on that, we have the university, as I said, I've had quite a rough time personally, and they have been fantastic. We also, the faculty, have a peer support program which you can get involved in. So I would stress that you're never alone. Death in particular is something that I think everyone deals with very, very differently, and the university teaches you, you know, skills and ways to go to deal with it, but when it comes to it, obviously it's going to be a confronting situation. But I'm not scared of it. Saying that, you know, like I know that I will have the support from my peers, but also my supervisors in the university. And, you know, if you need to take the afternoon off, I'm sure that they would be okay with that or whatever. I don't know what Ashley's view is.
Well, yeah, I haven't really been exposed to it that much yet, but in first year and second year, we have a subject, medical, professional and personal development, and we touch on that. Initially, it's more like ethics and values of a doctor, but we do a little bit on breaking bad news, and in first year we did a case where our patient did end up passing away, and one of the objectives in the last session of that case was how we felt about that. Like, even though it was just a patient on a piece of paper, like, we still went through it, and we were quite serious about like what happened in that situation and how to go through it. So you do get exposed to it, and I'm pretty confident that with the university's help would be fine in that situation. So
We've just got just a couple more minutes for questions. Yep.
Is there any difference between the bonded and the non-bonded medical place in terms of what you do during the university?
No, it's exactly the same. Really, that's before you come into the university, and sort of as you come in, and as I mentioned, it's the contract between you and the government, which happens after you finish. Content is exactly the same, nothing different. Yep. No, it's within the same application on SATAC, so you get 6 preferences and you can select both of those in your preferences. How you order that is completely up to you. We would suggest whatever your number 1 wish list is, that should be at number 1, and then the second preference should follow your sort of wish list essentially. Yep. Okay, I think we've got time for one more question.
Just with specialisations, obviously there's a lot of areas you go into. Does the university sort of help, like, guide you towards those people as well with those specialisations, or is that something you kind of have to get your own connections?
So the question was, does the university guide you towards what specialisation you should do? Yes and no is the answer to that. We're responsible for undergraduate education, but obviously many of us teach postgraduate training as well, and many of the people who teach postgraduate training are also involved in coming into the medical school. So you get exposure to people across a range of specialisations. I think, as Jessica said, you know, one of the reasons people make career choices for the rest of their life is an experience they have while they're at medical school. A great mentor, or they suddenly find they have a real interest or a passion or a talent for a particular area of clinical practice. So your experience in medical school is critical in guiding people towards that. And it's a natural thing that people love their own specialisation, and anybody who shows an interest in that as a student is likely to be able to get that extra degree of mentorship and encouragement, you know, if they're interested in doing it further. There are a couple of other opportunities as well. I mean, by picking and choosing which selective elective options that you have, you can spend more time in a particular area. That includes the opportunity to do research. So you can do an extra year of research, and again, a lot of people do that because they're interested in specialising ultimately in a particular subject area. There are also a number of undergraduate groups that have formed within the medical school who are particularly passionate about a particular area. So I'm an obstetrician, so we have a really active student group of students who are interested in doing a career in women's health, who organise special events, clinical skills training days, and are part of a bigger national network of undergraduates who are interested in that. So it's not an official faculty thing, but it is something that takes place at medical school that helps you decide about specialisation.
Okay, thank you. That's all the time we have for questions, but I'm sure Professor Simons and both Jess and Ashley wouldn't mind. If you do have any further questions, we can chat out in the foyer afterwards. So thank you very much. I just wanted to mention briefly about some student support. So for our Indigenous students, we're lucky enough to have the Yatchaparuna Indigenous Health Unit and 2 dedicated student support officers that will assist our Indigenous students from inquiry right through to enrolment and throughout their program. We also have a health and medical sciences scholarship, so it's worth up to about $10,000 a year for the length of the program. So if you were studying medicine, that would be for the full 6 years. There's more information online, so I won't go into too much detail at the moment. And then lastly, our peer mentoring program. And Jess might like to talk briefly just for a couple of minutes on this, as she has been part of the program as both a mentee, so a new student, and then a mentor as well. So over to you, Jess.
Get behind it. It's an amazing program. It's people like myself, just being a friendly face for you to ask those questions, or, you know, have a coffee, tell you where to find, you know, you can't find this building, or just to get you in, you know, the university can be a big daunting new experience, so it's just a nice friendly face to say hello and, you know, be a protocol pretty much. So highly recommend getting behind it, even if, you know, you use it for the first couple of weeks to get your feet, you know, that's fine. We don't mind that as mentors. It's not like you know, you've got to come every Wednesday. Yeah, definitely friendly face pretty much, so highly recommend it.
Thanks, Jess. And I know Ashley moved from Central Victoria, so she's also accessed a lot of the support services through the college that she lives in as well. So please make sure that they're available to you. Please make sure that you use them. It's better to ask the question than to not, and to reach out to those people. We have them available. Please use them. So did you have anything to add about that, Ashley?
Well, Jess was my mentor, so I went to the same school as Jess, but we didn't really know each other back at school. But yeah, it's just having a friendly face, like moving from interstate. Knew no one in this entire state when I arrived, but now I love it here. I've got so many friends here, and yeah, it's just things like this that when you first move and you don't know anyone, you don't know anything about uni, it's just nice to have the friendly people around to help you out. So
excellent, thank you very much. Okay, ladies and gentlemen, that concludes our medicine session today. So thank you for attending. We hope to see many of you as new students here in the future.